Good afternoon, doctor. My name is EshikaParuchuri, and I'm a sophomore at Woodbridge Academy. I would like to begin by thanking you for joining me in this initiative. My main goal is to educate adolescents around the world to help them construct a healthier lifestyle by working with experienced doctors across different specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Brinda Joseph, who specializes in dentistry. She has experience in this field serving the New Jersey area and performs dental procedures focused on the prevention of oral diseases such as tooth decay and periodontal disease. And for this episode, we'll be focusing on multiple dental issues faced by teens, as well as the steps that can be taken to have healthy teeth and a lifestyle. And now, Dr. Joseph, can you give us a little background regarding your experience in this field?
Hi, Eshika. I'm Dr. Joseph. I'm a general dentist serving all the population right from newborn kids, babies, until the age of 80 plus years old. So I pretty much see all types of patients and wherever the referrals are needed. I'm an international dentist from India, and I came to US again, and I went through the dental school to get the license to work as a dentist, to practice dentistry in US. So that's pretty much about me.
Very nice and interesting. So let's dive right into the questions. What is a cavity? How is it formed? And how does it cause issues?
So a cavity is a decay in the tooth, and the number one reason for the cavity is the sugars. So usually all the human beings have a variety of bacteria in their mouth, but there are certain bacteria, when they react with these sugars, they produce acid, and this acid actually like erodes or it decays the enamel, causing cavities. So for a cavity to be formed in your teeth, there are three main factors. One is the bacteria, the sugars that we eat, and also the teeth. That's where the cavities are forming. So these are the three main factors for the cavity.
Oh, okay, I see. What is dental sealant and how does it prevent cavities?
So the dental sealant is, it's like a thin, um, like a paint like, or you can say like a thin plastic filling. It's very thin. It's done on the top surface of your permanent molars, and sometimes even on the premolars. So our permanent molars and the premolars, they have deep grooves where it is more prone to get cavities. So when these sealants are placed on top of them, it prevents forming cavities. So that doesn't mean that you don't have to brush your teeth, you still have to brush, but these are like a preventive measure, preventing the cavities forming on the top surface or the chewing surface of your teeth.
Okay. What are some long-term effects of untreated cavities in teenagers?
Okay, so if you don't treat cavities right at the beginning stage, it's going to, so the cavity first forms on the enamel, and deep below the enamel is the dentin. So even if it goes to the dentin, you're going to start feeling sensitivity, and once below the dentin is your nerve. So once it goes to the nerve, you're going to feel the pain. That is when the toothache starts. So sometimes it can go deep into your nerve, and it can cause infection like abscess or swelling inside your bone below in the roots of the tooth. So cavities cannot be ignored thinking that it's not going to get deeper or bigger. It's obviously going to go deep into your layers of your teeth and finally get into the nerve.
Okay. How have dental diseases and the techniques to fix them have evolved from when you first started to now?
Definitely, dentistry is evolving in terms of treatment. There are so many advances in dentistry that's that comes up. Dental diseases, how the dental diseases are evolving, is based on our diet. So, of course, our diet has changed a lot. So our diet recently, I would say, has predominantly become more of sugars and the let's say sugars or acidic drinks like carbonated drinks which are more acidic. These are the main big factors causing more decay in young population than a few decades ago, because now we have now there are so many different options for teenagers in their diet, like the drinks, the snack, the sugary snack, and everything.
Mhm.
So that's causing more decay in young population. And regarding the treatment, treatment, it's really a very vast topic. So the filling materials have changed over time and they have become more better, more best, I would say. So that's
Mhm.
completely a different, but definitely dentistry has evolved a lot.
Very interesting. Can dental diseases be genetic?
So we cannot say it everything as genetic. So
Mhm.
sometimes when the teeth are not aligned properly, or let's say the teeth are very crooked, that's because the child has inherited a small mouth and a big teeth from both the parents, and that's why the teeth has no space and they're kind of crooked in their mouth. That can be genetic. But regarding caries, there might be some periodontal disease. It's very rare that
Mhm.
may cause, that may, the genetic might be the reason, but you don't have to go deep into it. But your caries is mostly because of your diet and your hygiene, oral hygiene.
Okay, I see. What are the different warning signs and symptoms of dental disease?
Warning signs and symptoms, of course, if you don't, if you have sensitive teeth, if you have pain, then you have obviously have dental disease. And sometimes some people have jaw pain, which they think, or sometimes when you wake up in the morning, you might have
Mhm.
mild soreness in your muscles around your mouth, or you might have mild headache, which people think something else, but that might be because of your TMJ issues, which a dentist can diagnose and treat. So these are some other dental diseases, the signs and symptoms. Like these are
Mhm.
some of the symptoms of TMJ disease, and pretty much for especially for teenage age, these are the main things. And bleeding gums is obviously
Oh.
a sign of dental disease, and sometimes even bad breath can be, there might be an underlying factor for a dental disease. So when you go to the dentist can diagnose exactly what's going on and how to treat them.
Oh, that's very interesting. There are a lot of factors being taken into account.
Yes, that's right. Yeah.
And how do you tell if it's a dental issue or something else that's causing the pain?
That's when you go to the dentist first takes a complete history,
Mhm.
and then you get a lot of x-rays taken, which can diagnose any dental diseases. And obviously when the dentist checks your mouth, they will know if something is going on in your teeth, in your mouth, or that's when the dentist will refer you to a specialist, whether they are
Oh.
medical, or if even if there are multiple specialties in dentistry that they can refer, so who can do even more elaborate testing, like
Mhm.
do all the tests and diagnose.
Okay. What habits and lifestyle behaviors should be established in adolescents for good dental health?
So what habits and lifestyle. So number one is oral hygiene habits that we can talk about.
Mm-hmm.
So definitely, you have to brush 2 times a day, morning and nighttime, right before going to bed. Flossing is also very important because brushing alone will not clean away the plaque. That's the food that's stuck on your teeth. Flossing will clean in between, in the interdental spaces. It removes the food that's there, which can cause cavities and gum disease. And flossing at least once at night time is very important. These are the
Okay.
oral hygiene habit, and definitely cleaning your tongue can be part of your oral hygiene,
Mhm.
because that also plays an important role in your keeping your mouth fresh. So you can use a tongue cleaner to clean your tongue. And then regarding habits, sorry about that.
No
So
problem.
regarding these are the oral hygiene habits. And lifestyle changes, I would say dietary changes,
Mhm.
like not snacking sugary foods throughout the day, because that's the main reason for cavity. And
Okay.
also drinking soda or carbonated beverages or sports drink can also cause cavities and lot of other dental issues. So these are the main dietary factors that can
Mhm.
that, if you take into account, can prevent dental caries and other dental diseases.
Okay. And what are three healthy foods that we should incorporate for healthy and strong teeth?
So for healthy teeth, I would say use like you can have fruits or vegetables um, as a snack. I know vegetables you don't, I don't know how many of you want to take as a snack, but fruits and nuts. Cheese also is a very good snack instead of other sugary snack like
Mhm.
cookies or candy or like pastry. These are, or cereals, those are also full of sugars. So I
Yeah.
would say healthy snacks like fruits, nuts, and cheese is a very good snack. And pretty much in your diet, all try to have like a uh, proper diet with carbs, protein, and fats. Everything should be equal. Like everything, whatever is needed, is a healthy diet that is going to uh, be beneficial for your oral health as well.
Well explained. Can you also explain the importance of staying hydrated for oral health?
Okay, so staying hydrated is very important for keeping our teeth free of cavity, and also it's very important for our gum health, because the, like I said, the three factors in which are causing cavities: the bacteria, the sugars, and then the host factor is your mouth, your saliva, and your teeth. Those are the important factors that are causing cavities, right? So when you have when you have a dry mouth, your saliva is kind of acting mechanically, cleaning your teeth and your mouth throughout the day. So when you have dry mouth, you're more prone for cavities. So staying hydrated means drinking water. That's number one. It doesn't mean that you can drink juice or
Mhm.
like carbonated beverages, because they have a lot of sugars and they're very acidic. So try to drink water sip water throughout the day and be hydrated. So that is going to actually prevent cavities, and also it keeps your gums healthy.
Okay. Can tooth decay happen as early as young age, like in uh, toddlers?
Yes, tooth decay can happen and it can happen as soon as the babies start getting the teeth, if they don't care for it, if the parents, they don't take care of the child's or the baby's oral hygiene. So it can happen at very, very young age, even at the age of 1 year.
Oh, wow.
Cavities can form. Yeah.
And can factors like anxiety cause dental problems?
So anxiety, it might not be directly related to dental problems, but there are some medications. If they take any medications for anxiety, that can cause dry mouth, which in turn can cause dental issues. So that's the reason always a healthy diet is not only good for your body, it's very important for your oral health. Healthy diet and healthy, like especially keeping hydrated very well. So that's how anxiety might be contributing. The
Okay,
medications for anxiety might be the main reason.
I see. Can you name some common dental problems that you have seen in the young adults and teenagers?
So young adults, the number one is decay, the dental caries.
Mhm.
And then sometimes if they have, if like crooked or malaligned teeth, they will have gum inflammation because it's very hard to keep their teeth clean. So that can cause gum inflammation, which can cause bleeding gums. That's something that can happen. And sometimes some kids might have like nail biting, or
Mhm.
which is going to cause chip in their teeth, and that's very bad habits uh, for your teeth, for your health, for your oral health, right? So usually for teenage age, and sometimes there might be thinning of the enamel. It might be the early stages of erosion, the dental erosion, which is caused by drinking a lot of sports drink or carbonated beverages, which are
Mhm.
very acidic. So that can cause thinning of the enamel in the initial stages. The teeth might look a little yellowish, but then if they continue, then they're going to have a lot of other issues.
Okay. How has the COVID-19 pandemic impacted dental health?
I think COVID-19 has, I mean, during the COVID time, I think people had very limited, they didn't want to go out because of COVID. They didn't want to have a regular checkup with the dentist.
Mhm.
So it was very restricted. So I think they went to the dentist only when they really had a lot of issues, like
Mhm.
pain or real pain, or in their mouth. That's when they went to the dentist. So, and then I think especially some population might have lost their jobs during COVID, which
Mhm.
might have impacted their dental visits, going to the dentist regularly. And of course, like when you're uh, not able to go out much, you snack a lot at home watching
Yeah.
TV, and you don't like some people might not have a routine, and they might be snacking
Mhm.
throughout the day, which might have impacted their oral health as well.
Interesting. And can you define dental emergency?
Dental emergency is pain in your teeth, and you are like it's going to, the pain is going to impact you, that you're in all ways, that you're not able to do your routine uh, work in a day, typical day, and you have to go to the dentist right away. Otherwise it's like it will not, like, it's not going to let you sleep or um, do anything. So it's like an emergency dental visit. That's when you go to the dentist.
Okay. How often should teenagers visit the dentist?
So the teenagers must go to the dentist every, it's not just teenagers, it's right from as soon as a baby get teeth, they have to start going to the dentist every 6 months. So the same applies even for the teenage age. You have to go to the dentist every 6 months
Mm.
for your regular checkup, cleaning, and if any treatment is recommended by the dentist, then you take care right away.
Okay. Can hormonal changes during puberty affect dental health?
I mean, maybe not to very much like a lot of extent. Maybe the food had the dietary changes during your the puberty
Mhm.
can impact if you don't focus on your diet. You might have you might be prone to eating more lot of sugars, and that might
Mhm.
impact your oral health mostly.
Okay.
And then like I don't know, puberty, hormonal changes. If you don't want to do a proper routine, like a hygiene routine every day, then obviously
Mhm.
that's going to impact your oral health, right? If you don't
Yeah.
brush properly every day, if you're lazy, you don't want to do things.
Yeah. Are there any specific dental issues that affect teenage girls more than boys?
mm, I don't know. I don't think so.
Hey.
I don't think so. It's like just for girls and boys separately.
Mhm.
Any dental issues, because I don't think there's something specific for girls.
Okay. Is there a significant difference in using a regular toothbrush versus an electric one?
Definitely, electric ones are more. So they are much better in the way because uh, most part they go like in between your teeth really
Mhm.
well, and you don't have to do much. All you have to do is hold it in the right spot and make sure you go through all your teeth. So that is one difference. That electric brush, it's more much better in cleaning, keeping your teeth clean. But it doesn't mean that manual brushes are very bad. Definitely, manual brushes are also toothbrushes are also good, and you have to make sure that you use only a soft bristle brush. And if you use the right technique with a manual brush, it's equal, and it's really equally good like an electric toothbrush.
Okay. What are the consequences of not addressing dental problems early in life?
So consequences is going to be more extensive dental work if you don't take care of your dental issues at the early stage. Then the dental issues are going to get more bigger, and the treatment is going to be more extensive. And
Mhm.
even in that stage, if you don't take care of your teeth, then you're going to lose your teeth, which is going to impact um, your smile, your confidence, because everything is your teeth. Like it, not only not just your teeth for your chewing or eating, but your smile plays a very important role in young
Mhm.
age to be very confident. And because you're going to go out and explore the world, and you're going to as teenagers, you're going to explore the world, and you're going to have a lot of ambitions. So at that stage, you don't want to lose your teeth and lose your confidence, right?
Yes. With that being said, we will move on to our second section, which consists of common myths about teeth and dental care.
Okay.
If my teeth don't hurt, they're fine.
No, that's not true, because there might be some dental issues that will not cause any pain in the beginning stages. So only when you go to the dentist can tell you if something is going on. The dentist can find out if even if it's in the early stage, and address the issues before it becomes bigger and cause real pain for you. So it might, you have to, no matter what, you have to go to the dentist every 6 months.
Mhm. Brushing harder cleans better.
No, that's not true, because brushing harder actually is going to damage your enamel.
Mhm.
Brushing the right way, the correct, using the right technique is what make is what is going to make your teeth clean. So never try to use a lot of pressure when you brush your teeth. It's going to not only wear off the enamel, but also it's going to damage your gums.
Oh, okay.
So you have to hold the brush at 45 degrees towards your gums, and you have to go back and forth in small strokes. This way you have to go over all the surface of the teeth, and also you have to go from outer surface, the inner, and then the chewing surface. You have to cover all the surface, but never use too much pressure, and don't brush really hard.
Okay.
And definitely make sure you brush for 2 minutes.
Yeah.
Yeah.
Only sugar causes cavities.
So that's not true. Sugars and acidic beverages also can cause cavities, like acidic beverages like
Mhm.
uh, carbonated drink or sports drink. And sometimes some people like to suck lemon, or they try to sip lemon juice throughout the day because they are very acidic. Actually, they kind of erode the enamel, which is going to cause more issues like sensitivity, and they can decay the teeth as well. So we have to be very cautious about drinking acidic drinks. Like, you think, you some people might think, oh, okay, it's just fruits or orange, or let's say lemon juice or orange juice, they are healthy. Definitely they are healthy, but don't sip it throughout the day.
Mhm.
And if you drink it at once, try to rinse your mouth with water right after drinking those uh, drink. And then sports drink and carbonated beverages are very acidic. They have sugar, and also they're very acidic. So that's
Oh,
really very bad for your teeth.
okay. White teeth are healthy teeth.
Uh, so it's white. Some people, it's actually it's their own perspective. Definitely. So some people think they have so always the natural teeth has a slight yellowish tinge. So that doesn't mean that you have unhealthy teeth.
Mhm.
Obviously, whiter teeth looks very pretty, and uh, they look very healthy, but that doesn't mean if someone has slight yellowish tinge, the teeth are not healthy. Still, they are also healthy. So just by looking at someone, you cannot say. That's why we want everyone to go to the dentist 6 months once, so they can find out if something is going on at very early stages.
Okay. Baby teeth don't need much care since they will fall out.
That's not true. Baby teeth has to be taken care just like adult teeth. Though they're going to fall out, they can cause a lot of issues if you don't take care of them, and if you don't brush well. The baby teeth are going to, they also get cavities, they also get infections, swelling, and everything just like adults. And in many ways, they're going to impact your permanent teeth erupting in future. So baby teeth needs equal care and attention just like adult teeth.
Okay. And now we will move on to our last and final section, which consists of our final questions.
Okay.
The first one is a scenario. Let's say an individual is doing their regular brushing routine when they notice that their teeth are bleeding. What can the individual do in this particular situation?
So, along with brushing, like I said at the beginning, flossing is very important. So, if the individual doesn't floss, they're going to see some bleeding in their gums. So regular flossing is where some people say I floss only weekly twice or I floss once in a while. That's not going to take care of your gums. You have to floss every day, which is going to actually keep your gums healthy and stop the bleeding.
Okay.
So brushing and flossing is important. Along with brushing, flossing is very important to keep your gums healthy.
Okay. Can you talk about one interesting case that you have dealt with in the past?
Mm, interesting case. Like there are so many.
Maybe
So
something that struck out to you was very different, or
like
something that was rare.
for a teenage
Uh,
age or
Anyone in general. It doesn't have to be teenage.
mm, I I have so many cases. I just couldn't come up with just one scenario, but many people when they think oh they have everything perfect
Hmm.
and then they don't have any complaints, but when I visually see something going on, definitely that throws them back.
Yeah.
So very very small things like for example they might be using a medium bristle, which was actually gradually wearing their enamel off. They are not even aware of it. But when I see them when during the routine checkup, I can immediately tell them like, okay, your teeth are starting to wear off, your gums are getting damaged. So try to what's going on? Are you using a soft brush? Then they say, oh, I'm using a medium because medium bristle toothbrush because
Mhm.
I feel it keeps my teeth clean. So that's when I tell them, okay, no, that's actually damaging your teeth. So make sure you use a soft bristle. So that is common even in teenage age uh, people.
Okay.
So sometimes some people think, okay, I don't have any issues, I have perfect teeth, but then until you go to the dentist you will not know if you're doing something, if there is something different that you're doing in your oral hygiene that's impacting your oral health. So always discuss with your dentist about what routine you have, oral hygiene routine you have, and what is if everything is okay with your oral health.
Mm. Okay. And lastly, what is your take on Google Doctors?
I would Google doctors are not doctors. It's just like it's just um, internet platform where you get all the information.
Mm-hmm.
You take the if you can read the information, but don't follow them. Go ask your dentist what the Google says, and then clarify with your dentist. But don't try to clarify your doubts with the Google. But
Yeah.
Google, just take the information, just read it, and then don't don't follow it or don't trust it. Whatever you have doubts, go to your doctor.
Yes, agreed. A lot of, I think, many misconceptions happen.
Yes.
Yeah.
So Google doctors are not, they're not doctors. That's all I can say, right?
Okay. And with that, our podcast session has now come to a conclusion. I would like to thank you for your time, inputs, and contribution. It is very appreciated and will help in this initiative. So, thank you, Doctor, for your participation in today's episode. And for our listeners, we have a slogan. So,
Thank you so much, Ishika. It was good talking to you and sharing a lot of information.
I
And
have a slogan which I would like for you to repeat.
so, nourish your habits to flourish your lifestyle.
Thank you.
That's
And
great.
don't forget to follow us on healthyteens.net, where you can see all of the information of our upcoming podcasts. And with that, we'll see you in the next episode. Thank you. Bye.